So we're all systems go to vaccinate as many people as possible to minimise the damage a fourth COVID-19 wave might bring. But a number of independent pharmacies say the Department of Health is not paying them for the jabs they've been giving out to uninsured people. And they cannot afford to carry on giving out free vaccinations. Well, I'm joined now by Jackie Maimin, CEO of the Independent Community Pharmacists Association. Good evening and thank you so much for joining us. Could you start by just outlining exactly what the agreement with the Department of Health was around your pharmacies giving out free jabs to people who don't have medical insurance?
Sure, Sally, and thank you for having me. So you'll know we started vaccinating back in May. And in the beginning, we were not vaccinating uninsured people unless they were referred to us by the EBDS. However, in July, a circular came out which basically opened it up. I think the National Department of Health realized the asset they had in the private sector and the accessibility that we represented. So this was opened up, and then we started vaccinating uninsured and insured. We've got a sales and distribution agreement with the National Department of Health, and that states that we will vaccinate, we will be supplied with vaccines, and we will vaccinate everybody within whichever age category is open. The agreement further is that if we vaccinate uninsured, we will be passed a credit note for that vaccine. So in other words, the vaccine then is free of charge. Plus, we will be passed a credit note for the 80 Rand and 50 cents, which is the administration fee. Now, this administration fee, by agreement right in the beginning, is a cost recovery admin fee. So it covers things like the syringes, the needles, the diluent, staff time, overheads. It really is operational. There's no profit in this.
Right.
I think pharmacy right in the beginning said we're not here to make a profit. So they would also pass a credit note for that. So we were on the understanding we would receive vaccines. When we get invoiced, we would be passed credit notes for all the uninsured that we had done. And that's where we're stuck now. This mechanism to claim for the uninsured and to pass credit notes is not in place as yet.
So how much money is owed?
Well, you know, Sally, we were doing a quick calculation because, as you rightly said, a few of our pharmacists absolutely are saying they have got cash flow challenges, and a couple of them have said they're going to have to close their doors unless something happens. So if you look at a tray of Pfizer vaccines, that's 1,170 vaccines, times that by the 80 Rand and 50 cents, and you will see that that's about 100,000 Rand, just under 100,000 Rand. That is what it costs you to administer 1,170 vaccines. If we're looking at the Johnson & Johnson, that is 480 vials or 2,400 doses. That is about 200,000 Rand to vaccinate one tray of Johnson & Johnson.
Right, so what is the department saying? Are they disputing the money and this admin fee, or are they saying, sorry, we're running late on this?
Yeah, no, they're not disputing the admin fee at all. Basically, what they're saying to us is it is very complex, and we know it is, because we've got distributors, we've got multiple affiliates, and all the rest of it. So we know. But what we felt should have been done and should have been in place months ago was we had brought the mechanism to them, which is the MediCredit mechanism. It's a paying facility that we use in the private sector. And this needs to hook up to the EBDS so that we can submit our uninsured claims. This is not there.
All right, so are some of your pharmacies at a point of saying we're just not going to give out these vaccinations?
Well, a number of pharmacies have. And Sally, I just also want to say that it's very much, there is a point where, sort of a break-even point, where if you do a certain percentage of uninsured, the government starts to owe you money. Because something the department has said to us all along is, don't worry, we won't charge you for vaccines until the mechanism is in place, which is fine if you are getting the reimbursement for the private sector patients. But a lot of our rural pharmacies, and these are the ones doing the big Johnson & Johnson trays, have got up to 97% uninsured. So I know one in the rural areas doing outreach to farms and mines, they've gone through 5 trays of the Johnson & Johnson. So that's R1 million in overheads with no payment in sight. And they are the ones that are saying, we're going to have to close down. We cannot carry R1 million. We have to pay our nurses. We have to buy syringes and needles. And so, yes, we're very concerned about those pharmacies.
Yeah, it sounds like they need urgent help. I have to ask you very quickly, the last time we spoke was during the July unrest when so many of your independent pharmacies were vandalized. You were so concerned that some of them would not reopen. Give me an update.
Absolutely. So you'll remember it was 86 pharmacies, Sally. We've had a wonderful reaction to our call for pledges and funds. We've raised just about R9 million. And of those 86, 60 pharmacies have reopened. So we're very pleased about that.
Thank you so much. So unfortunately, over 20 had to close permanently, but most of them were able to reopen. Thank you very much, Jackie Maimin, CEO of the Independent Community Pharmacists Association. Very troubling news about that non-payment for those uninsured admin costs with the jab that can really slow things up, particularly in the rural areas.